Assalamualaikum warahmatullahi wabarakatuh. Hello everyone, my name is Nabilah Aulia Gunawan. I'm from R4A class. In this video, I will talk about high blood pressure. Hypertension is blood pressure that exceeds normal limits. Hypertension is a risk factor for attacks and heart failure because these organs have an important role in supplying blood. For this reason, hypertension is a condition that needs to be detected and recognized as early as possible by all people. Hypertension is a medical term when the condition of blood pressure in the body exceeds normal limits. So, blood pressure is divided into two parts, namely systolic and diastolic. Systolic pressure is the pressure when the heart pumps blood throughout the body. On the other hand, diastolic pressure is the pressure when the heart relaxes and receives blood before pumping it back to the rest of the body. If blood pressure is allowed to exceed normal limits, it can lead to serious complications, such as stroke, heart failure, kidney disease, and so on. For this reason, hypertension is a disease that needs to be treated as early as possible. The causes of this condition vary by type, namely primary and secondary hypertension. Some of the causes of hypertension are follows. 1. Primary hypertension. The cause of this type of hypertension is not known with certainty. However, there are several triggering factors for primary hypertension, such as family or genetic history, unhealthy lifestyle, obesity, and others. 2. Secondary hypertension. The cause of secondary hypertension is caused by certain medical conditions. One disease that is quite related to secondary hypertension is kidney disease. In addition, secondary hypertension can also be caused by several other conditions, including Cushing's syndrome or overproduction of the hormone aldosterone, Cushing's syndrome or excess cortisol, obstructive sleep apnea, coarctation of the aorta, taking certain drugs such as decongestants, and so on. There are symptoms that can be felt by people with hypertension, but keep in mind, not all people with hypertension will feel these symptoms. Often cases of hypertension are found in asymptomatic patients. Some of the symptoms of hypertension are as follows by 1. Headache, especially in the back of the head. 2. Vertigo, tinnitus, or buzzing or hissing in the ear. 3. Vision problems. 4. Hard to breathe. 5. Pain in the chest. 6. Arrhythmic conditions. 7. Fatigue. How to deal with hypertension must be done medically so that the handling is right and doesn't worsen the condition. People with hypertension are generally required to take medication for life so that their blood pressure can be maintained. However, there are several conditions in which people with hypertension can lower their dose or stop taking the drug, especially if their blood pressure is under control by adopting a healthy lifestyle. You can take steps to implement a healthy lifestyle, such as eat enough salt, no more than 5 until 6 grams per day, maintain normal weight, limit consumption of caffeine so as not to overdo it, eat healthy foods such as vegetables and fruits, avoid smoking habits, exercise regularly, limit your intake of foods that are high in saturated fat, reducing alcoholic beverages, manage stress by meditating, adequate and quality sleeps. So, hypertension is a disease that can be caused by hereditary influences as well as external factors, so that preventive measures are needed by maintaining a healthy lifestyle. If you feel the characteristic of hypertension as mentioned above, you need treatment and treatment from medical personnel. It is also important to have regular blood pressure checks to detect hypertension early. Thank you for watching. Have a great day and stay healthy. Wassalamualaikum warahmatullahi wabarakatuh.